Good afternoon. Thank you for joining us at the earlier time today, and just a reminder that these briefings from now on will be at this earlier time of 12:15. Let me start with the usual update on the COVID statistics. I can confirm that an additional 22 positive cases were confirmed yesterday, which takes the total now in Scotland to 18,474. Now, these cases are all being looked into very carefully, as you would expect, and steps taken to trace contacts and break the chains of transmission. A Health Board breakdown of these new cases will be available later today as normal. However, the provisional information I have at this stage is that the majority of these cases are in Lanarkshire, and at least some of them are likely to be connected to the outbreak at the Cittal call centre that has been doing work for NHS England. I will chair a Scottish Government resilience meeting later this afternoon to consider the latest situation in Lanarkshire and also consider any further steps that may be required. And of course, we will keep you updated over the course of today and again at the briefing tomorrow. I can also report that a total of 618 patients are currently in hospital with the virus, either confirmed or suspected. That's 51 more than yesterday and includes an increase of 4 in the number of confirmed cases. And I'll say a little bit more about the suspected and confirmed breakdown in a moment. A total of 4 people last night were in intensive care with confirmed COVID, which is an increase of 1 since yesterday. And there were also 16 people in ICU with suspected COVID, and that's 9 more than yesterday. Now, it's worth saying that although we have all along reported both suspected and confirmed COVID patients in hospital or in ICU, that has, as you will have noticed again today, sometimes caused fluctuations in the daily figures. And that is partly because most patients in hospital who are over the age of 70 are now tested for COVID every 4 days or so. And these patients are often counted as suspected COVID cases until the results come back, even if there is no reason to believe that they actually have the virus. For that reason, from tomorrow, we intend to report only on confirmed COVID cases in intensive care and in hospital, which I think gives us a more accurate picture of the situation. And this is also part of a wider review of how we will report information, which I'll say more about later this week. As we go into the next stage of dealing with this epidemic, it's important that the information we are providing gives you, the public, the most reliable and comprehensive picture of how the virus is behaving. And finally, on statistics, I'm very glad to say that during the past 24 hours, no deaths were registered of patients confirmed through a test as having the virus. And so the total number of deaths under this particular measure, therefore, remains at 2,491. That is, of course, very welcome news, but the overall figure for deaths is a reminder of how many families have been deeply affected by this virus, and my thoughts are with everyone who is grieving a loved one. In addition, I want to thank our health and care workers. The entire country continues to be very grateful to you for everything you do. The Deputy First Minister is going to speak in a moment or two about the reopening of schools. The Chief Medical Officer will then talk about our decision to make COVID testing available now for children with COVID symptoms who are under the age of 5. This is a step which is designed to prevent families from having to self-isolate unnecessarily if young children develop symptoms, something which we think is increasingly important as childcare resumes. Before their remarks, though, I want to cover a couple of points. Firstly, I just want to say a little bit more about the figures for new cases that we have seen in recent days. Since the last media briefing on Thursday, there has rightly been quite a lot of attention paid to the fact that we reported more than 20 new cases on both Saturday and Sunday, and of course I've just reported more than 20 today. And I've already mentioned the cluster of cases identified in the call centre in Lanarkshire. Now, these figures are, I think, a sharp reminder of something that you've heard me say almost on a daily basis, that the virus is still circulating in Scotland, and it's also a reminder that if we allow it to, it is capable of and will spread rapidly in social settings or in workplaces. That said, a great deal of work is being done, and this is the point of assurance I want to give you. A great deal of work has been done, not least through Test and Protect, to understand all of these cases, follow up contacts of them, and make sure that all necessary and appropriate steps are being taken to break the chains of transmission. In total, more than 25,000 tests were processed across the 2 days of the weekend when we reported more than 20 cases. And even though the number of cases that we reported on these days was larger than usual, they are still at a relatively low level. And so new cases can be assessed in quite some detail. Health Protection Scotland can tell us if new cases are clustered and if any particular patterns are being identified. Where care homes are involved, that enables necessary precautions to be taken, and of course Test and Protect staff are tracing and testing contacts for all cases that are identified. So while any rise in new cases is unwelcome and we want to drive cases to as low a level as possible, it remains our objective to try to effectively eliminate COVID in Scotland. But while any rise is unwelcome, we've always said that the virus is still out there, so as lockdown eases, cases unfortunately are possible. And the job of our public health teams and Test and Protect, supported by the Scottish Government, is to step in and break the chains of transmission wherever possible. And I want to say my thanks and give my gratitude and appreciation to our public health teams and Test and Protect staff right across the country. But the key point I want to make to you is this: we all have a part to play in keeping this virus under control. Things like physical distancing, washing hands and surfaces, wearing face coverings, indeed all of the elements of our Facts campaign continue to be absolutely crucial. I think we're all conscious of the fact that as life starts to feel a bit more normal than it has done for months, there is a danger that we are all capable of succumbing to, of dropping our guard. But I think we should all stop right now and think about whether that might be true, if we have been dropping our guard and if the evidence of that is there in our own behaviours. And if it is, then all of us should resolve to tighten up again. Remembering all of the basic measures which are summarised in the Facts campaign, they become more and more important as we see more people and have more indoor meetings. So at all times as you go out and about, please make sure that you avoid creating any bridges that allows the virus to cross from one household into another. If we all do that, we can continue to protect each other and stop the spread of the virus. Now, the second point I want to briefly cover today relates to well-being. At last Thursday's briefing, you might recall I mentioned the work we're doing to support the mental health of people who've had COVID and been in intensive care. We're also making sure we provide support for health and social care staff. Many of them have faced the most testing and stressful conditions of their entire working lives over the past few months. They have responded magnificently to incredibly challenging circumstances. There's already a national wellbeing hub that provides online help and support for NHS and care staff. It can be found at www.promise.scot, and that is promise spelt PROMIS. Today we're also launching a dedicated phone line, and I'll give the number in just a few moments. It will allow health and care workers to talk to a team of psychological wellbeing practitioners who will provide a sympathetic ear while also providing advice and referring people on to local services if necessary. The line is open from today. It's open 24 hours a day, 7 days a week, and it is available to all health and social care workers. So if you are stressed or anxious, if you find the last few months difficult to cope with, and it would not be a surprise if that were true, and if you feel you need support, then you can call 0800 111 4191. That's 0800 111 4191. The line will be open for at least a year, and I would encourage any health and care workers to use it if you do need help, or even if you just want a sympathetic ear to listen to the stresses that you have been dealing with. Now, I'll hand over to the Deputy First Minister in a moment, but I want to end really by going back to where I started today, by reminding you again of facts, the basic 5 health measures that we need everybody to abide by if we are to keep this virus under control. And as I said a moment ago, and I want to stress this point, these things are more important now, not less important, as we are going out more to shops, restaurants, as we meet each other more indoors. So they are more important than they've been before, and that's why I ask everybody to remember them. And those 5 measures are face coverings in enclosed spaces. The law says you have to wear a face covering in a shop or in public transport, but in any enclosed space where physical distancing might be difficult, please wear a face covering. Avoid crowded places, and that includes outdoor crowded places as well as indoor crowded places. Clean your hands regularly and clean any hard surfaces that you might be touching regularly too. 2 metres distancing. It does remain the rule. Perhaps that's the one that we all need to remind ourselves of over the next few days, that it is still important that we keep 2 metres from people in other households. And lastly, self-isolate and book a test if you have any of the symptoms of COVID. Don't wait a few hours or a day to see if you feel better. If you have a new cough, a fever, or a loss of or change in your sense of taste or smell, go immediately to the NHS Inform website and book a test, and self-isolate with the exception of going to get tested. If we all remember these 5 basic measures, then we give ourselves the best possible chance of keeping this virus under control. So my thanks to everybody for your cooperation. But this is a moment, I think, for all of us across the country to take stock, to ask ourselves if our behaviour perhaps has been eased up a little bit too much in recent days, and to resolve to follow all of this advice so that we do not see this virus running out of control again. So my thanks to all of you for doing all of that. I'll hand over now to Deputy First Minister, who'll say a bit about schools, and then I'll hand over to the CMO before we take questions as usual.
Thank you, First Minister. Last Thursday we published the latest scientific advice on both physical distancing and safe school transport, which was produced by the Advisory Group on Education and Children's Issues. Today I'd like to provide a brief update on the preparations that are being made for the consideration of that advice alongside our partners in the Education Recovery Group. The group met on Friday last week and is due to meet tomorrow and again to meet later on in the week. Working in that collaborative manner, we are making good progress towards our shared ambition of safely reopening schools in August. I'll make a more detailed statement to Parliament on Thursday, during which I intend to provide clarity on the practical and logistical preparations that we are making for school reopening, including on vital health protection measures. Those measures will include issues such as a surveillance programme, outbreak management protocols, and quick access to testing for all symptomatic staff and pupils. Through implementing such measures and reopening our schools, we can continue to address the impacts of the virus on the health and well-being, educational progress and attainment of our children and young people. But we will only be able to open schools if we continue to effectively suppress the virus. A decision on that question will be made on the 30th of July. Until then, I want to emphasise the importance of working together to achieve this. Every one of us has a critical role to play in this national mission, be it as parents, carers, teachers, or other essential parts of the school workforce, and I'm very grateful for the energy and commitment directed at achieving this aim. Our vision for education in Scotland remains to achieve excellence and equity for all of our children. Having witnessed at close hand the endeavours of colleagues across the sectors in recent weeks, I'm confident that we will continue to support our children and young people to return safely to education and to achieve this aim. And I look forward to being able to offer more detail in my statement to Parliament on Thursday.
Thank you. John Gregor.
Thank you, First Minister. Today I want to provide you with an update on access to COVID-19 testing for young children under the age of 5 years old. Since the 18th of May, testing has been available to everyone in Scotland who has symptoms of COVID-19 and who is over the age of 5 years old. Up until now, testing for children under this age has been limited to clinical settings and has been undertaken only when there's a clear clinical need that's been identified. As we change restrictions and progress through our route map, we are continually reviewing the scientific advice and the evidence that guides us. As a result of this, we've decided to make testing available to children and infants under the age of 5 years old. We know that young children can become infected with COVID-19, but are unlikely to have severe symptoms. At the current time, the evidence suggests that it's very unusual for the infection to be transmitted amongst children and from children to adults. As we change the restrictions across the country, there are more situations where people are able to meet. The recent reopening of early learning and childcare settings, along with the change in physical distancing guidance on children under 11 years old, means that our youngest children are now able to mix more. And as this happens, and as we approach this autumn and winter months, it will be important to know if a young child's symptoms are caused by COVID-19 or not. We want to avoid households having to isolate for prolonged periods unnecessarily if young children in their family are displaying COVID-19-like symptoms, but do not have COVID-19, as these symptoms can be common in this age group. So from tomorrow, parents and carers will be able to book and complete a test for a child of any age who has symptoms of COVID-19. By accessing our Test and Protect programme through the NHS Inform website or by phoning 0800 028 2816, you will be able to book a test for children under 5 years of age. Tests for all children under the age of 11 years old, accessed through Test and Protect, are undertaken by the child's parent or carer, using the clear instructions provided. As with all those who receive a positive test, if a child tests positive, they will need to isolate for 7 days from the onset of symptoms, and household members will be asked to isolate for 14 days. This change, supported by our clinical cell, means that our testing for our youngest children is aligned across all the nations in the UK.
Okay, thank you, Gregor. We'll move straight to questions now. First question from Katie Hunter at the BBC.
Afternoon, everyone. The staff at Sitel have received a letter from NHS Lanarkshire saying that if they test negative for COVID and don't have symptoms, it's still essential that they complete the 14 days self-isolation. But some staff are under the impression, and I've seen correspondence around this, that they could be asked to go back sooner if they test negative, and if they don't, they may not be paid. And given the update you've just given us, is it safe to assume that that building will remain closed for at least 14 days?
The building is closed right now. It will remain closed for as long as is necessary, and we will proceed on the precautionary basis that we are applying to all of our decisions right now. As I said earlier on, I'll chair a resilience committee meeting later this afternoon to get the latest update, and also to consider any further steps that are necessary. I know the incident management team is also going to be meeting this afternoon, so we will absolutely make sure that all appropriate and necessary steps are taken, and that the well-being of staff, but also the wider public health concerns in terms of stopping this virus spreading are absolutely at the forefront of everything that we do. And we will keep the public, obviously, in Lanarkshire, but more generally updated as we have more information and on the substance of any decisions that we take this afternoon or beyond. Gordon Cree from STV.
Yes, thank you. I'm in Motherwell, but obviously there's a degree of concern about this outbreak. What level of additional public concern do you think there needs to be in this area as opposed to elsewhere in Scotland? And at that meeting this afternoon, is any sort of local restrictions on the agenda for things you might be considering?
Look, I'm not going to preempt decisions and discussions that will be taken and held later this afternoon. Before that meeting happens this afternoon, I certainly hope to be in possession of more detail about today's cases and whether or not they are all associated with the outbreak, or whether there are any wider issues there. And we will take decisions based on the most up-to-date and comprehensive information that we can. And if we take any decisions, whether in relation to this outbreak or any outbreaks we see in the future, we will communicate them openly in the normal way. In terms of the first part of your question, I want everybody across Scotland to be really vigilant when it comes to complying with all of the public health advice. I know how difficult it is, and I know that as aspects of our life feel more normal now than they have done at any point in the past 4 months, aspects of what we're asking people to do become more difficult, because instinctively it is more difficult to remember all the time to keep 2 metres distance. I understand that, I really do. But that's why I'm saying right now, I think all of us should just take a pause and consider our own behaviours and ask ourselves, are we maybe dropping our guard a bit more than we should do? And if you think that's the case, resolve now to tighten up on that. Let's all of us do that and consciously think about every decision we're making about interactions with other people, so that we are not giving the virus possible bridges to jump across. So that's my advice and my plea to everybody across Scotland. Of course, and I said something similar when we were dealing 2 or 3 weeks ago with the outbreak in Dumfries and Galloway, that if there is an outbreak in a particular area, I suppose I would underline that, doubly or triply. But it's not, I don't want people to get the impression that it's only if you live in Lanarkshire that you should be following this advice. You should be following this advice wherever in Scotland you live, but clearly in Lanarkshire there is a need to be extra vigilant in making sure that all of those steps are taken. And if we all do this, then we can't guarantee we will see no cases of this virus, but we give ourselves the best possible chance of minimising transmission, and also giving Test and Protect and our local public health teams the best possible chance of stamping on these outbreaks if and when they happen. Deborah Haynes from Sky News.
Sorry, can you hear me?
I can hear you, yeah.
Thank you. Just turning to the Intelligence and Security Committee's report today on Russia, they say that they found that there was evidence that Russia tried to interfere in the 2014 Scottish independence referendum. What do you say to that? And are you worried that Russia is again trying to interfere in efforts to hold a second referendum, with the intent being to try to split Scotland off from the UK and make the UK weaker? And just secondly, are you worried that given there is this evidence of Russia attempting to interfere in the Scottish referendum, that the government then didn't see fit to task the UK's intelligence agencies to look into whether or not the EU referendum was also similarly targeted by Russia?
Deborah, this is a COVID briefing. I think that's been made pretty clear. So I'm going to limit what I say on other issues, because it's really important that people have the opportunity to watch these briefings and hear a focus on COVID issues. If there is a more elaborate response that you want from me on the Intelligence and Security Committee report later on, I'm happy to provide that. So I will keep my comments here reasonably limited. As you can probably gather from my COVID remarks so far, I've been pretty preoccupied with All Matters virus this morning. I've had an initial read-through of the Intelligence and Security Committee report. I will read it in more detail when I get the opportunity later on. I would say firstly that we should not be at any point complacent about the possibility of Russian interference in our democratic processes. Secondly, I don't think you can really draw any conclusions from the 3 lines or thereabouts that the report has on the Scottish independence referendum, but I would include that in my general remarks about not being complacent about Russian interference, although I would say that the Scottish independence movement and the kind of values I and my party stand for, I don't think could be further removed from the kind of values that Vladimir Putin and the Russian regime stand for. On the Brexit referendum, it appears that the committee concludes that there's no evidence of interference there because the UK government hasn't looked for it. And that brings me to my last point, which is the question you asked me at the end. I do think the main message out of an initial reading of this report would be what I think could possibly be described as negligence on the part of the UK government in the face of potential Russian interference. And I hope that this report leads to a much more rigorous approach, and to the UK government taking these threats to our democratic processes much more seriously than they appear to have been doing so far. But if you don't mind, I will conclude my remarks there and get back to issues COVID. Callum Clark from Bauer.
Good afternoon, First Minister. Edinburgh Airport has written a joint letter to yourself alongside Unite the Union, warning that 2,000 of the 7,000 jobs there could go as a result of the pandemic. This letter was written last week. Can I ask, have you had any dialogue with Edinburgh Airports or Unite the Union since then? And secondly, what message would you have for staff at Edinburgh Airport? And just a quick question, if I may, to Dr. Gregor Smith. Fourth News has been speaking to an Edinburgh dentist who's warning that hundreds of cases of mouth cancer may be going undetected in Scotland due to restrictions on dental practices. Can you offer any indication on when these restrictions may be lifted?
I'll hand over to the CMO in a second on Edinburgh Airport. I think the letter you referred to was received by us last week. If my memory serves me correctly, it will be responded to fully. I have had interaction with Edinburgh Airport, not directly and personally since the letter was received, but previous to that. Aviation is one sector of many that is under severe pressure because of the pandemic, for reasons that people will think as obvious, given the nature of the restrictions that we have been living under. I'm very mindful of that in the decisions that we take, and you've seen the care we have taken over decisions around air bridges, for example. But my primary responsibility right now is to make sure we keep this virus under control, because if we don't keep this virus under control, then the implications of that for all sectors of our economy, including aviation in the medium to long term, will be even more severe than the implications that the economy is facing right now. So everything comes back to that primary need to keep this potentially deadly virus under control, or we will face a lot of very serious implications that none of us want to face. Gregor, sorry.
So we're already seeing some dental services opening up, the routine services. It's important that we perhaps don't start undertaking the aerosol generating procedures right across Scotland just now, but where there's a need for a procedure like that, there are some arrangements in place to allow that to happen. The issue of mouth cancer, though, is slightly separate, though, because although many of these are picked up during routine examinations by dentists, it's not the exclusive remit of dentists. And what I would encourage people to do, it tends to be a condition that particularly affects males and very often older males. And I would encourage people that if you have got any sores or ulcers in your mouth that just really aren't healing over time, whether they be on your cheeks or in your tongue, is that's something that you should be exploring a little further, either with your, as I say, your registered dental practitioner or with your GP.
Alan Zazinski from Global.
Thank you very much. Good afternoon, First Minister. I'm just looking for some clarity on this one in regards to the changes to the Spain quarantine rules. We've spoken to a couple of people who are flying back from Ibiza to Scotland tomorrow. They're trying to fill in various forms just now, but they don't really know what answers to give. The changes are coming in later this week, we've been told. Do you have an exact date for that? And given they're coming back early tomorrow, will they need to quarantine for 2 weeks?
Look, they'll be given appropriate advice when they travel. I'm not going to get into the position of responding to an individual set of circumstances when I don't know all of the details of their travel. We will lay the regulations this week in terms of Spain, and the advice that is given to travellers will be updated after that. Anas Hassan from Kingdom FM.
Thank you very much, First Minister. Our radio station ran a snap poll yesterday which found around 3/4 of people don't support the addition of Spain to the list of places exempt from the quarantine rules. Many have also pointed out that there have been new outbreaks in the country. Firstly, are you out of touch with public opinion on this one? And secondly, have you simply bowed to pressure from the holiday and aviation industries?
No, that's not the case. Look, these decisions are not easy. They're never straightforward, and we take them with great care. And sometimes, I've said this many times before, I take the decisions, as does the Scottish Government as a whole, that we think are right and strike the best balance in all of the circumstances. Some of them will be popular, some of them won't be popular. In fact, I suspect most of the decisions we've taken in the past few months, by their very nature, don't meet, well, I hope and I do believe they have met with public understanding. I wouldn't describe them as being popular. We make an assessment on countries based on the prevalence data that we receive that comes from the Joint Biosecurity Centre. When we made the decision a couple of weeks ago not to exempt Spain from quarantine, I went into some detail about the relative prevalence rates between Spain and Scotland. The latest information is that the prevalence has dropped quite considerably in Spain, and that's the basis for the decision we've taken. That said, and this next comment doesn't just apply to Spain, it applies more generally, and I'm sure it applies on the part of other countries when they're looking at the UK in terms of these travel decisions. We keep this under very, very close review. So if some of the outbreaks that we're seeing in Catalonia just now, for example, feed in over the next week or so to higher prevalence rates, then that may lead us to a different decision. And the same will be true in other countries. When we made the initial decision a couple of weeks ago, you will remember then that although Australia was experiencing an outbreak around the state of Victoria and Melbourne in particular, we nevertheless had Australia on the green list because the evidence was that outbreak was being controlled. So it's not just outbreaks that we look at, it's the effectiveness of the control measures that appear to be in place. But none of these decisions, I'm afraid to say, and I take no pleasure in saying this, are cast in stone at the moment, because we have to be very vigilant about the situation in other parts of the world, just as we have to be very vigilant about the situation here in Scotland. And where decisions have to be taken in the interest of keeping this virus under control, we will not shy away from taking those. Katrine Bussey from PA.
Good afternoon. I wanted to ask about the cluster of cases at Sitel, but also more generally about the larger number of cases we've seen in recent days. So first of all, on Sitel, how concerned are you by media reports that employees weren't adhering to social distancing requirements in the call centre? But more generally, do the larger number of cases give you and the government pause for concern as we go through this process of coming out of lockdown? And I don't know if the Deputy First Minister would want to comment, because obviously we're coming up to a point where a decision has to be made about whether schools go back full time or not, and how much the higher figures might impact on that.
I'll hand over to Deputy First Minister in a second, because that is a obviously very important point. Let me try and answer the main part of your question, and in doing so strike the best balance I can. You asked me, am I concerned? There's not been a day in the past 4 months now that I've not been in a state of high concern about coronavirus, because it remains a very real threat to us. And therefore, if you hear me in the foreseeable future saying I'm not concerned, then that should probably worry you. That said, I would say a number of things. Although the case numbers over the last few days have been higher, we have also in some of these days been doing significantly more testing. A lot of that testing now is the regular testing that's been done in care homes, in particular the regular weekly testing in care home staff, and a not insignificant number of these cases have been in care homes in different parts of the country. So that's a bit of context. The number of cases, although higher than we had been seeing for the last couple of weeks, are still at a relatively low level, and still under 1% of all people tested are testing positive, although we continue to look very carefully at the trend in these figures. So I think it's important to keep it in context, but, and again, people have heard me say this so often in the past, I assume, we know from our past experience at the start of this epidemic how quickly it can spread, and how a relatively small number of cases suddenly become a much higher number of cases. And that's what we've got to do everything in our power to guard against. And that involves all of us following all the advice that I've been talking about, but it involves our public health teams, test and protect, working as hard as possible to identify cases, to then identify all the contacts of positive cases, trace them, make sure the right advice has been given around self-isolation, and any other steps are being taken to break those chains of transmission. So, I think it is self-evident that I am concerned about any cases that are being identified, but I am most concerned to make sure that we're doing everything in our power to stop onward transmission. And that's why that will be such a focus in Lanarkshire over the next, for however long it takes to satisfy ourselves that this is under control, and anywhere else that we see these outbreaks cropping up. Your point about, am I concerned if physical distancing advice is not being adhered to? Again, yes, and I come back to this, none of us are perfect. We all have to constantly remind ourselves of the importance of this in our own social interactions. But we also have an expectation of businesses and employers that they will make sure that these pieces of advice are being followed rigorously for the protection and well-being of their own staff, but also to avoid the kind of situation that we appear to have here in Lanarkshire, of a workplace cluster of cases. This call centre, as is widely reported, has been doing contract work for the NHS England test and trace system. There are other call centres that will be engaged in that work, and we will be taking steps to reinforce that expectation with NHS England and with companies generally in Scotland, that there is a real responsibility here to make sure all of the relevant guidance and all of the relevant guidelines are followed. John, do you want to say a bit more about schools?
Thanks, First Minister. In my remarks earlier on, I said that we will only be able to open schools if we continue to effectively suppress the virus. And that is my overwhelming point that I'd want to make, that I understand, and indeed I'm one of the strongest advocates of the importance of reopening our schools. Reopening our schools will be good for the well-being, for the educational opportunity and for the support for young people within our society. It's critical that we get schools open at the earliest possible opportunity, but it has to be done safely. And if we find ourselves in a situation where we are not able to effectively suppress the virus, then the opening of schools becomes called into question. Now, we're working very, very hard on all fronts to suppress the virus and to make sure we have all of the preparations in place for the restart of schools in August. But we all have to recognise that we have a role to play in making sure that we make that possible by suppressing the virus and taking and following all of the steps the First Minister has talked about to make sure that we don't see cases emerging. And as we've seen from the example in Lanarkshire, we can see how quickly a particular weakness that happens within the system can then lead to the transmission of the virus, and we have to avoid that at all possible costs.
Michael Blackley from the Daily Mail.
Thank you, First Minister. Good afternoon. I understand, obviously, that isn't the primary purpose of this press briefing. However, there is quite a lot of public interest in the Intelligence Committee report. Both Labour MP Ian Murray and Murdo Fraser of the Conservatives have called for a full inquiry into what Russian interference there has been. Is that something that you would be prepared to launch?
Look, I don't think it would be for me to launch it. I think it's for the UK government to launch it. I may have got this wrong, but I think I saw a comment from the UK government just before I came into this briefing suggesting that they had ruled out the call of the Intelligence and Security Commission for an inquiry into that. So, you know, intelligence and security are reserved matters. So if there is to be an inquiry into this, I would certainly have no objection to that. On the contrary, but it is for the UK government to do. Beyond that, I gave a reasonably full answer to Sky News about my response to the report, and I don't have anything to add to that at this stage. Chris Musson from The Sun.
Hi, First Minister. You've just accused the UK government of negligence over its apparent failure to act over the Russian interference. And as you just said, you're aware the UK government has said it won't be carrying out its own inquiries. You haven't carried out any inquiries into alleged 2014 interference. So is this not negligent too?
Intelligence and security matters are not the responsibility of the Scottish Government. I think you know my views on the extent of the responsibilities of the Scottish Government, but intelligence and security is a reserved matter, and therefore I'm not entirely sure how anybody thinks it would be possible for me to launch the kind of inquiry that the Intelligence and Security Commission is calling for. You know, I'm happy to respond more on this. Some of the reporting that we saw in some sections of the media this morning, I think, were not quite borne out by the contents of the report. But I'm very clear, whether you're talking about the independence referendum, the Brexit vote or elections, we should not be complacent about the prospect of Russian interference. And I think the key message of the report is perhaps the UK government has been, and it is their responsibility. And I hope we will see perhaps a more constructive response to the report than the comments that I've seen so far suggest that we're going to get.
First Minister, can I just check? Do you think that Russia tried to interfere in 2014?
Well, I only know what I've read in the report this morning, which is about 3 lines and a footnote, which seems to suggest that the only evidence the committee was able to source was open source. It wasn't UK intelligence or security information. So I don't know that. But what I'm saying is the UK government should be taking greater steps to find out whether it's about that part of our democratic process or the Brexit vote, where the report seems to be very explicit that they haven't even bothered to look into that. So these are responsibilities. This is a report that has been kept hidden from the public for months. Now that it's out there, I think the questions that should be asked are for the UK government, who are the government responsible for intelligence and security matters. Now, I have sort of denied my own ordinance here by answering these questions, because you're perfectly entitled to ask them. But this is a briefing to give the public across Scotland updates on COVID. So I'm going to try to get back to that. And if there is more information or more response from the Scottish Government anybody wants on the Russia report, we'll be happy to provide it later on. Simon Johnson from The Telegraph.
Hi, First Minister. Just going back to the Spanish situation and the decision yesterday, there were 383 cases in Spain on July the 8th, which is the day in which you announced that Spain wouldn't be added to the quarantine-free list, and 685 cases in Spain yesterday. And I just wondered if you could say a little bit more on the scientific and statistical underpinning behind yesterday's decision. And just on the ISC report this morning, I mean, you said in response to Sky News that obviously your party does not share the values of the Putin regime. However, certain members do appear on RT and Sputnik, and the report this morning made clear the significance in which those channels play in disseminating Russian disinformation. Would you consider removing the party whip from those people that do in future?
My views on channels like RT and Sputnik is well known, and you're well aware of it, and I've got nothing to add on that. If people are interested in the actual contents of the Russian report, and I say this, Simon, with the greatest respect, as I'm sure, I would encourage you to read the report and not the account of it in the Telegraph newspaper this morning, because I think that perhaps is what I was referring to earlier on when I referred to some overspinning of some aspects of it. But on that, my view is clear. We should not be complacent about the prospects of Russian interference, and I think the issue here is that the UK government, who bears responsibility for these matters, has been complacent in the past, and hopefully that's an attitude we will see change. On Spain, we've used the same prevalence data that we founded our initial decision on. We'll share the actual numbers that we base this decision on, but we keep this under review. We see a volatility around the virus in many countries right now. We see an outbreak that we're dealing with here in Scotland, which again underlines that need to be very vigilant, and also to not be stuck in decisions if there is a case for changing these decisions. And again, my view, whatever decisions are being taken around air bridges or the quarantine requirements for particular countries, I guess my advice to people in Scotland is still to, if you want to be on holiday, if you're able to take a holiday over this summer, stay in Scotland and take that holiday, support the tourist industry, and make sure you're abiding with all the rules. And that's my advice to people, regardless of the particular quarantine arrangements that apply for different countries. Muir Dickey from the Financial Times.
Thank you. Are there any indications that any of the recent new cases of coronavirus that have been recorded are stemming from people travelling into Scotland from elsewhere? And in particular, where do you think, or where does the government believe that the infection or the virus got into the Sitel facility?
I have no information at the moment that would, in terms of the first part of your question, that would lead me to think that is the case, but I would put a very heavy caveat on that the investigations and exploration of these cases is still underway, and I certainly will want to keep an open mind on any potential sources of transmission, so that we are then keeping a very open mind on what we might need to do to stem those. And on CTEL, we'll have a further session, as I said earlier on, where I hope we will get more information on the current situation, and if there's more information we can provide, I'll be happy to do that. Do you want to?
I think if I could add one comment to the analysis the First Minister's talked about just in the last remarks that she's made. There is very detailed work being undertaken by NHS Lanarkshire on identifying the connections and the routes by which the virus may have entered the facility, and to establish all of the possible connections and relationships. So that's very, very detailed work that is underway, but it is being done because we have to satisfy ourselves as to what has been the source and how we can remedy that either in that circumstance or in wider advice and guidance to the wider community in Scotland.
Alistair Grant from the Herald.
Hi there, First Minister. Thanks very much. I just wondered if I could get your reaction to comments today by Gabriel Scally of the Royal Society of Medicine. He said Scotland is now within touching distance of getting to zero COVID, but he is desperately worried progress may be undone by the effective lobbying of the airline and tourism industries. He said he is astounded by the power and influence that airlines are able to exert. Have airlines and the tourism industry exerted too much influence in this debate? And is the power of these sectors a risk to progress? And if I could also just ask, do you have any concerns around official and state-backed Russian sources perhaps spreading disinformation around coronavirus?
On that last question, I think I've been pretty clear. I do think we should take care not to be complacent about Russian interference and potential dis or misinformation, and that includes around coronavirus. And I think there is a need for much greater vigilance than perhaps the UK government has shown so far. On the comments that you've asked me to respond to, I've not seen the comments in their entirety, so I'll obviously would want to do that before I commented too much. What I would say, obviously the aviation sector, the tourism sector, different sectors of the economy are going to make the case for what they will consider to be their ability to safely open up. The government has got to take balanced decisions, and we've got to take those balanced decisions, which, as I very often say, are not easy decisions, and they're very rarely black and white. We have to come to a careful overall judgment on these issues, and we take account of what we have described in previous documents and previous discussions as the four harms. We know that the virus does very direct public health harm, but we know that the measures we have taken, principally through lockdown to control the virus, does different harms. It does its own harm to health, it does economic damage, which then can feed through into health damage. So we have to balance all of this. In some ways, it might be easier just to stay in lockdown forever and never give the virus a chance to spread. But we can't do that because we know that does damage of its own. So we have to take a very careful and considered approach to coming out of lockdown. And that's what we've sought to do. But we said all along that we must remain vigilant. And at any point, if we think we have to go backwards or pause on any changes in the future, then we will not hesitate to do that. And, of course, we listen to all sorts of views and opinions. But ultimately, the responsibility is on the government to make sure that we are reaching these decisions in a careful and cautious way, and that's what we've been seeking to do. Gina Davidson from the Scotsman.
Thanks, First Minister. Just on this letter that you've received from Edinburgh Airport and Unite the Union, they talk about potentially 2,000 job losses on the airport campus, plus another potential 7,000 across their supply chain. Although it's not in the letter, sources have told me that they would like to see some kind of cut to APD, temporary possibly, just to help things. I wondered if that was something that you might be looking at. Also, a question for the Deputy First Minister. In terms of the schools going back, there seems to be a lot of concern around secondary pupils in particular, and distancing in classrooms and around schools, and also on school transport. And I just wondered if you could give any reassurances to parents today about how these things are going to be achieved.
On the point about aviation, I don't have the letter in front of me, so I'm not going to comment in detail on its contents. It has been received and it will be responded to. You will be aware, I'm sure, of the hold-up around the devolution of APD, given some of the issues around the Highlands and Islands that we've not yet been able to resolve with the UK government, and therefore that is an issue in terms of any consideration there. Beyond that, we will take budgetary decisions in the normal course of considering these matters. John.
First was on the advice that we've received from the advisory group. It essentially gives what I would describe as an unequivocal statement that amongst younger children there is no necessity for physical distancing or either in classrooms or in school transport. But it's less emphatic around secondary pupils, and there are some issues that have to be wrestled with there. That's essentially the material that we're looking at as part of the guidance that's been constructed to make sure that we put in place mitigations to reduce the risk of any potential transmission of the virus in the way in which we reopen schools. So what the expert advice has assisted us in doing is identifying what are the very, very clear and sharp issues that have to be addressed, whether it's around about accessing school, going around school, participating in normal educational activities, and particularly making sure we get that right for secondary pupils and most particularly for pupils in the senior phase. So that information has all been assessed just now as part of our discussions in the Education Recovery Group, and it will form part of the guidance that's issued to the education system should we be in a position to reopen schools full-time in August.
Tom Martin from the Daily Express.
Hi, thank you, First Minister. Just a brief question for the Deputy CMO on the rollout of, well, expansion of testing for younger children. Is this done in a different way at all to other age groups, given, you know, in the past there's been talk around the discomfort for elderly people in getting a swab, for instance? I just wondered if there's any differences in the practice involved.
So thanks for the question. I mean, at this moment in time, it's exactly the same type of test. It's done in the same way as people in kind of older age groups just now. That's why we've been particularly cautious about the rollout of this. However, we've now looked at the evidence around this again. We've taken advice from paediatric and child health specialists in relation to this, and they're confident that actually the advantages of introducing this test in this age group now outweigh any disadvantages that it might cause.
Derek Keeley from the Courier.
Thank you, First Minister. I wanted to ask you about support for coach operators during the pandemic. The Transport Secretary announced last week funding packages to help councils speed up timetable journeys and private tour companies reduce emissions. The specific support for the coach industry was at the time ruled out. The concern is that it may take longer for the coach sector to bounce back than other industries because it will take time for international visitors to return. And we've heard stories of businesses having vehicles taken off them because they're unable to keep up with finance payments. The Confederation of Passenger Transport is calling for a rescue package based on investments made by firms on lower emission vehicles. How would you respond to those calls, and would you make any commitment today to make that support available?
No, I can't make commitments today that the government hasn't had an opportunity to properly consider. We will, of course, listen very carefully, as we have done throughout, to any sort of suggestions and demands that are made from particular sectors. We will not always be able to do everything that a particular sector wants us to do, but we, as I think we've demonstrated so far, we will do as much as we possibly can to support businesses in the short term, but also support businesses and the economy more generally as we navigate our way into the recovery phase of the virus. So we will obviously consider the particular requests that you refer to and respond in due course. Kieran Andrews from The Times.
Thanks very much, First Minister. Routine testing for care home admissions began on April 22nd. You told Sophie Ridge on Sky on May 31st that you might have changed that policy earlier if you'd been aware of asymptomatic transmission. But Devi Sridhar told Times Radio this morning that asymptomatic transmission was being reported on in scientific journals from mid-February. I was just hoping you could please clarify when exactly you were made aware of the risks of asymptomatic transmission, and if you weren't given sight of the reports referred to by Professor Sridhar, why not?
don't know what reports Devi has referred to in your newspaper this morning. I'll look at that and then see whether I saw them at the time. But I've responded to this from your colleague, actually, Mark McLaughlin, on several occasions. The thing around asymptomatic transmission, and forgive me if I've expressed this in different ways at different times, but the key issue here is that it's not been black and white. So nobody has ever said there was a categoric assurance that asymptomatic transmission couldn't happen, but the likelihood and the possible contribution of asymptomatic transmission to the overall spread of the virus, our understanding and knowledge of that has absolutely changed. And there is still, I remember quoting some of this to your colleague a few weeks ago, there is still within the scientific community what I would describe, I think, as a difference of opinion as to just how big a contribution to overall transmission asymptomatic carriers of the virus make. So it's not the case that anybody has ever said categorically one way or the other, but like many other aspects of the virus, our knowledge and understanding has changed along the way. Greg, I don't know if you want to add.
Yeah, I mean, I think it's been one of those areas where the scientific community still is very divided on the whole influence of asymptomatic transmission. Even in the last couple of weeks, I've read other reports which suggest that asymptomatic transmission isn't making a significant contribution. I think it's right that we adopt the precautionary principle at this stage in dealing with the pandemic when we consider how to go about it. But really, this has not been a settled scientific question for right from the beginning at all. And even the WHO have debated this long and hard and have adopted various positions over the course of how they've dealt with the pandemic as well during those initial months through March and well into April as well.
And last question today is from Chris McCall at the Daily Record.
Thanks, First Minister. I'd like to raise again the issue of face coverings. While compliance in shops and on transport is generally high, there appears to be a stubborn minority who refuse to wear them. So I'd like to ask, would you consider tougher penalties against those that don't wear face coverings? And on that point, do you think more Scottish politicians should be perhaps seen wearing them, even in, say, the Chamber at Holyrood?
We'll consider anything that we think is required, whether that is, greater penalties for not wearing face coverings or whatever, although I should say there is no there's no particular proposal in front of us right now to do that. I have to say on face coverings, and I'm only speaking here from my own observations, but also from anecdotal feedback. I think since we moved to mandatory face coverings in shops, all of the information I have is that compliance is very, very high with that. And I think that's a positive and a good thing. And if there is anybody who still is stubbornly refusing, as opposed to people who may have a legitimate reason, a health condition for not wearing a face mask, I would simply ask you to think, why would you stubbornly refuse? You don't stubbornly refuse, or at least I hope people don't, to put on a seatbelt in a car or to follow other public health guidance. There is evidence that it does help stem the transmission, and by wearing a face covering you help protect other people, and they, by wearing one, help to protect you. So let's keep that compliance high, and if it needs to get even higher, let's resolve to do so. But I think on face coverings, I have been I think very pleased with levels of compliance over the past couple of weeks. I think probably where all of us need to just tighten up again is around physical distancing. And perhaps if I have a concern, it may be that people, because they're wearing a face covering, maybe think they don't have to be quite so rigorous around physical distancing. So let's just remember each one of these 5 pieces of advice in the Facts campaign. It's important that we do all of them. So I'll end this final question here today by with the same encouragement I gave earlier on, and I include all of us in this. Just let's all take stock of our behaviour, and if we think honestly maybe we're letting our guard down a little bit around some of these things, then let's from here on in decide to rectify that and tighten up again, because we have plenty of reminders right now that this virus hasn't gone away. It is still out there, and it will take a grip of us again very quickly if we let it. So let's not allow that to happen. That concludes the questions for today. My thanks to John and Gregor, and to Anna, our BSL interpreter. My thanks as always to Journalists and to all of you, we'll be back here tomorrow at the earlier time, again of 12:15. And in the meantime, please remember facts: face coverings, avoid crowded places, clean your hands and hard surfaces, 2 metres distancing, and self-isolate and book a test if you have any of the symptoms of the virus. Thank you very much, and I'll see you tomorrow.